And these are obviously two belonging together somehow. If you look at them, you'll see that they're shaped slightly elongated. You see, this is a little oblong. And this is also a little oblong, and so is this, oblong. That's because they are following the spinal nerve distribution. This is really interesting. Our skin and our nerves were made from the same part of our embryo. When we were embryos, we once had only two layers, the epiblast and the hypoblast. The epiblast has ultimately evolved during embryogenesis, while we are in the uterus, into both the entire nervous system and the entire skin. Therefore, if we have any kind of irritation, whether it's genetic, chemical, nutritional, or pollutional, or mechanical, any kind of irritation to the nerves will manifest on the skin, and vice versa. They're intimately connected, the skin and your whole central nervous system. If you are under a lot of stress emotionally, that's another reason why you're affecting your skin directly through the nervous system, which does not only bring information, sensory information, from the skin to the brain to tell us that the environment is changing, heat, cold, pain, pressure, bugs walking on us, these kind of things, but it also feeds the skin. The nervous system provides nutrients to the surface of the skin, and if the nerves are irritated, the skin will grow excessively because of that trophic feeding nutritive effect. So here's what results. She was born with a slight genetic tendency. That genetic tendency made her nerves more easily irritable by various environmental factors, nutritional factors, pollution, and emotion. It is a variant of a condition called von Recklinghausen disease, also known as neurofibromatosis. Neurofibromatosis. You heard about that?
The acupuncturist.
Some people have much longer, much bigger lumps than she does, and they have so many, and they always follow the spinal nerve distribution. That is why they're elongated along the spinal nerves. As they follow those distribution, if they have enough of them, they look like they have a Christmas tree right on their back, because it goes like this, following the spinal nerve the whole way. And this is why she has this here, because the spinal nerve go from the side through the rib cage, between the ribs, and they go to the front, all the way to the sternum. So you can see that she was irritated right from this spinal nerve, which started right here in the area of the neck, and it started right here. This is where she developed these. It comes from the same nerve root. Isn't that an interesting person? These are really good. You see how it started on both sides of the spinal cord, going right there inside the rib cage and coming out in the front. Amazing. Just beautiful. I couldn't have asked for a better specimen.
I was going to say one thing there. My dad's exact, like, it's a matching set.
It's a genetic tendency. Exactly.
Is this something she has to see to? Or is it just something she has to be aware of?
I'll mention it. Do you want to stand here while I mention it? Or while you're standing here, let's look a little further. You know. So she had already done a surgery here. Somebody tried to remove one of those. See that big scar? So that's already too much of a scar. We don't like that. But usually they do only one, and if it's not cancerous, they won't bother with anything else. They'll just leave it there until maybe something will change, and then they will do something else. So we don't like to wait. We just like to remove and not to worry about it. As far as what does it mean? No, thank you very much. I always, before I lecture about skin, I have to spot somebody.
So when I came in, I was still special.
Yes. So this is a genetic tendency, this von Recklinghausen. It can come in a very mild form and a very advanced form. People who have it in advanced form have pain, have dysfunction, have discomfort, because the nerves are always irritated and they cause all those globules on the skin. But even if you have a mild form, it means that there is irritation. when you are exposed to chemicals, pesticides, hormones, insecticides, those chemicals are neurotoxic. They accumulate in the nervous system and increase its irritability, which would lead to increased rate of mold. And many people who never had mold when they were born, over the years start developing more and more lesions on their skin. When you look at them, automatically you think that they're older than they really are. Because those skin lesions, when they protrude on your nose, on your cheek, on your forehead, right underneath your eyelid, or on your eyelid, or even touching your eyeballs, they are distracting from the rest of the face, and they give you a picture of lack of vitality. Nobody looks vital when they have mold on their face. Even if they have been accustomed to them, and even if their grandma was kind and sweet enough to tell them that it's beautiful, or even told them that it was a beauty mark, which really was a euphemism for when we didn't know what to do about it, so might as well learn to live with it. But now we know what to do about it and what we can do about it and why we should. It's very easy. There's no reason to euphemize it by calling it a beauty mark. It is something that develops as a result of irritation, therefore it's a pathological development. The skin is designed to be smooth. There are reasons for that. If the skin is not smooth, and we have growths that are asymmetrical, in her case they were fairly symmetrical. Some of them were not symmetrical, they had a few that were not. If you are not symmetrical, you are sending messages to the central nervous system in an uneven fashion. And that could affect you more or less depending on where in the nervous system you will have the asymmetry. If this asymmetry occurs in the brainstem, it will affect you dramatically. Because the brainstem is directly connected with your basal nuclei, the hypothalamus, the limbic system, the hippocampus, the orbitofrontal nucleus, all those important parts of the brain that have to do with emotions and that have to do with autonomic nervous system control, temperature regulation, dryness of the skin or moisture thereof. Everything has to do with the hypothalamus and how it affects our entire skin's physiology based on the messages it gets from the environment. And here it's getting uneven messages from the outside inwards. Suddenly, you have a big mole on your cheek, and your whole body becomes dry. And you don't even know it, because nobody even tells you that it's a possibility. And you remove it, and suddenly your whole skin becomes moist again. I've seen it happen. And we have the physiological explanation for that. It sounds almost mythical, doesn't it? Almost magical. But this area, the face down to here, is directly connected to the brainstem. And that is why the impact on the hypothalamus is so significant. I've seen people with lesions on their head, large lesions on the scalp, which were associated, unbeknownst to them, with constant anxiety attacks. But as soon as I removed them, using this non-surgical, non-damaging, non-traumatizing, non-invasive nutritional approach, suddenly the anxiety attacks disappeared as soon as the lesions came off. It's directly connected with your emotional centers in the brain. This is a nice feature. It's very physiological. All of those skin lesions have different names like moles, nevuses, pigmented, non-pigmented, complex melanocytic nevus, compound melanocytic nevus, simple melanocytic or non-melanocytic nevus. All those names are fancy names, but basically you can all call them lesions, skin lesions. Anything that is abnormal in the skin, even if you call it a beauty mark, is simply called lesion.
Is a wart a lesion too?
Wart is a lesion too. It's from a virus.